Deptford.
Okay, and how you spell that?
1PHERD.
Okay, no problem. And how should I call you?
You can call me Rajendra.
Rajendra.
Yeah.
Alright, Rajendra. So, how long ago did you see a doctor for the stomach flu?
About a couple of days ago.
Okay.
Yeah, 2 days
Can you
ago.
remember? Okay, 2 days ago.
Yeah.
And were you given anything for it?
Oh, was something beginning with P.
Okay. Alright. So do you know if it was like a supplement or if it was like, to kill germs, anything at all?
It was a yellow tablet.
Alright.
Yeah.
But because I'm not a pharmacist, I wouldn't be able to determine or kind of, figure out what that is. But tell me the symptoms you're having now at any rate.
Just constantly going to the washroom. Diarrhea.
Diarrhea?
Yeah.
Is it watery?
It is, yeah.
Any blood?
Not that I noticed.
And any odor?
Generally, yes.
Sorry, is it like excessively, is it different to what you're accustomed to?
Sadly, no.
Okay. Okay, do you have any other symptoms? Any vomiting?
No, but I've been feeling nauseous.
Okay. How long now you have the diarrhea?
That's been about 4 days.
Okay. How many times per day?
Anytime I eat.
Okay, so how many times do you eat?
Well, I've been avoiding food for that reason.
Okay. So while avoiding food, are you still having diarrhea?
No.
Okay. So when last did you have an episode of diarrhea?
Not long ago, before I got here.
Okay. Alright. Okay, any fever?
I've been feeling warm, but it's something I can cope with.
Okay. Anybody else at home with similar symptoms?
No, there's nobody there.
Just you alone?
Yeah.
Okay. Alright. Well, what I would suggest is, and what about in terms of your eating? Did you eat anything strange or different? Did you notice, like did you share me with someone and they also complained of having diarrhea? Nausea?
The last thing I had before it all started was curry duck.
And did anybody else have any problems having the curry duck?
No.
Just you. Okay, so it may not be food related then.
Right.
It sounds to me like it might be a stomach bug, as you said, a stomach flu, which means a virus is what is causing it. Just like how some people, when they have the virus, they get a runny nose or headaches. Yours is in the bowel.
Okay.
In which case, what we need to do is to give you something maybe to ease it. I may need to do a stool culture, i.e. get a stool sample from you and we send it off to the lab, since it's been going on for some time. But apart from that, just like we treat any other virus, we would need to give you or encourage you to have fluids, rest, and there's something, I don't know if you heard of something that people have been using these days for diarrhea, enterogermina.
No.
Okay, but I can always recommend, it's actually good bacteria putting back into your bowel so that you're not continuing to just lose because that's part of the immune system.
And what about if I take Imodium to stop it?
Right, so that's a very good question you're asking because sometimes patients just take something to stop the diarrhea before we know what it is. And the thing is, if the diarrhea is caused by a bug, you want that bug out. You don't want to slow down your diarrhea and keep the bug in. So that's why I'm going to take the sample. I'll ask you to do a sample for me, put it in a cup, first to send to the lab to make sure it's not any bugs that are making you sick. Once we confirm that, then we could look at slowing down the gut. And I don't know if I would go straight to Imodium. There are other things that we can do, right? I can even, we can talk some more about the kinds of things you're eating that may aggravate it. Is there anything else of concern?
No, I don't think so.
Okay, are you able to work with this happening?
I manage.
Okay,
Yeah.
so you don't need any time off or anything like that. Alright, so
Could I
what
get
I'll
time
do...
off?
Well, if you need time off, I certainly recommend it. If you are unable to cope at work, if you're feeling very weak and exhausted, I feel like I'm giving you the symptoms.
I could take two days off.
I am actually not opposed to patients needing to get rest, and sometimes that's what the sick leave would facilitate. But as I always say, it is not for you to go and do other things. It is because you are not well, you need to be resting at home and recovering and rehydrating, consuming lots of fluids, right? I don't know if you're happy with things like Gatorade or coconut water, those kinds of things, right? And avoid sweet drinks.
Okay.
Right, so what I would want to do, after I examine you, I'm going to send you off to the lab where I would need you to do these 2 samples for me, and then I'd recommend you come back in a couple of days' time. Right, and of course you can call the office if these symptoms are still continuing.
Okay.
Any other questions you have?
No,
Any other
no.
concerns? Anything on your mind?
No.
All right, Rajendra. Well, as usual, it was good speaking with you, and thank you for coming in today.
Thank you.
All right, you just follow the lab tech.
Well, we have to give a double round of applause because we didn't have a pause in between. And I bet you all wish all your lectures were like this, huh? Let's start in the order in which they appeared. Yeah, so we'll be dealing with Dr. Hannah and Rayanne. Any comments?
A phone ringing. You see that?
No, he said her phone rang. He didn't say anything. He just let her talk on the phone. And I find that strange because usually doctors would ask that your cell phone be on vibrate or silent during an interview or this ridiculous.
That's a point. If usually outside in the waiting room they ask you to put your phone off or on silent or whatever. But in keeping with the vignette, did you find that that was a plus or a minus? A minus. Okay. Anybody found it was a positive thing?
I think it was a plus just because it allowed the doctor to see how busy she actually is and how much work she always does. So it helps him.
That is, there are pros and cons. Technically, the phone should have been off, but in this case, I agree. I think that it was a positive sign because without trying to make a diagnosis of what happened, you could see that the patient was a little anxious and she wasn't really taking on what the doctor was saying. She wanted a prescription. Give me the prescription. I want to go. Oh, I've got things to do. I don't want to hear about rest and fluids and this. I've got stuff to do. So in this particular situation, though the phone technically should not have been on, the doctor could work it to his advantage, and this is exactly what happened. Good. Any other points that people noticed?
I would say that when the doctor was explaining that she needed rest and she was against it, he should have further went into the fact that if she did not take the 2 days initially, this could cost her about a week because she could have ended up becoming worse and then, been hospitalized or end up having to take a lot more time off.
Right. Good. Yes, that is a valid point. Sometimes though people, even though you tell them that, they still don't listen, but the advantage would be that you would tell them so that they would know. What about the fact that she was even telling the person on the phone that, look, I'm just here coming now, but I just have to get a prescription and go. Any comments on that? Anything that could have alerted, that the doctor could have done differently or that, yes?
Well,
I'm coming to you.
I don't know. And in this case, right, I think it's like a modern patient because, the patient these days, they self-diagnose. They'll go on the internet and when you go to the doctor's office, you think they know exactly what they want. So, but in this case, Dr. Hannah, he still took the time and did a proper examination, took a proper history, and actually proved to the patient that her whole, I don't know what the diagnosis, her whole thoughts on her disease were wrong. So it really shows that, like, in reality, in the setting, although the patient comes thinking they know what they want to do, go through with your procedure and come up with your own conclusion, don't let their
Right.
opinion
So you
screw
picked up that Dr. Hannah took the time to go through, but did the patient pick that up?
I think the patient.
I think the patient sort of went away and said, look, she'd be muttering when she went out, said, I don't know what I can, I just waste more time. And that type of patient too can doctor shop. Go to somebody where she will get. Which is why Dr. Hannah took the time to try and explain to her look, this is something that will cost you a couple of days, but in the long run, it will do you good. So that is a good point. And it was well enacted, so it worked. It became real.
I felt he could have been more sympathetic to her symptoms. Because, you see,
Should get better fast.
no, not to get better fast. To deal with the symptoms. I can give you this, and I can possibly reduce this and that. And I think he could have won her over a little bit more that way. That is my kind of, maybe I'm wrong, but I think that is why at the end, now of course the truth is that she does need the rest and she needs to shut down. But I think you need to kind of yield a little bit to the patient and deal with some of their concerns. And she wanted to get rid of a stuffy nose in her head. He did say, I'll give you a prescription for something. But I felt that he spent a little more time on that. He might have won her over a little bit more.
And if there was a little more time allotted to the vignette, it would have come out.
Yeah.
But it was just too short, so everything could not be put up in the same thing. So I'm sure if it were like one for the whole hour, then we would have been fine. So there are other things that need to come up there, but because of the time frame, we need to sort of move on. Perhaps these could be picked up again some other time in lectures. So let's go on to the last one with Dr. St. Bernard and Rajendra. You gathered that this young man was kind of busy, but he seemed to be wearing the stomach flu pretty well. You know, he was not grumpy, he was not aggressive, you know, he just said, look, I have stomach flu, and if you don't talk, I'm going to have to go to the bathroom right now. Remember when he said, well, just before I came in here, so that was the kind of hint. I'm going to be ready to go again soon. So, you notice Dr. St. Bernard did, again, just as Dr. Hannah did, elicit the history of the presenting complaint. So whatever they presented, I haven't forgotten it. You still had a comment? The history of the presenting complaint, and you try and find out a little more on, and in this, in both scenarios, in doing that, the allergies from Rayanne were elicited. And in this case, we got some specifics about, well, some very non-specific specifics about the tablet beginning with B and it's a yellow tablet. Now, this happens, people used to come with Smartie bags. Used to have tablets, used to bring all the tablets and show us, and they would look like Smarties or Skittles, colored. Now the pharmaceutical industry is trying to go white, have everything the same and just have sometimes in different shapes. And the white is not because they don't want the Smarties, but because some of the dyes were actually causing problems and people were allergic to the dyes and whatnot and whatnot. But it is something that really does happen in real life. Now, I think in this scenario, Dr. St. Bernard was deliberately trying to be a little perverse and say, well, I'm not a pharmacist, so I'm not going to know how that is. She didn't say it like that, but it could have been interpreted like that for this vignette. Whereas in another setting, and if she had chose to play another role, she would have said, even though I'm not a pharmacist, I can say so and so and so. So it just depends on what comes up, and everybody is going to have a different reaction. These 1, 2, 3, 4, 5 behaviors are going to be elicited in different ways by each one of you in this room. But remember, the core skills of empathy and compassion must be at the forefront. Make the patient feel comfortable at all times and offer advice where required. When the possibility of getting sick leave was brought up, this is a very touchy and delicate and tender subject, particularly in Trinidad. He just sort of said, I could get time off. It's like, okay. So when he said 2 days, it was like, whoa, I heard somebody behind me saying, at least take 2 weeks. But he probably did, because he was meant to be a carnival fat promoter. He can't take 2 weeks. Carnival will be over by that time. So he knew he could only take 2 days. So these kinds of things can happen. But doctor gave advice on taking sick leave and on the sick leave and what to do with it. Not to go running around and playing that you're normal for that. So, in summary, because I think Mrs. Williams needs to continue.
Yeah, we'd like Peter to go back to their classes to practice.
Right, so you'll have some practice time. So just as a quick wrap up, kinesics, body language, think about what you saw this morning with the 4 vignettes. Think about what happens when you yourself are a patient. Think about what happens in other encounters in terms of your body language. Think about eye contact. It's very important to make eye contact with people. Very, very important. If you don't make eye contact with people, they think you're not interested. And sometimes you've heard about this thing where people look to the left and they're thinking, you either think to the left or think to the right, but sometimes that can mean that you're guilty. Use of space. Some people do not like for you to get too close to them, so always keep your distance, and in Canada it's the proverbial 3 feet. Haptics, touch, you can develop a haptic relationship if you know the patient over a period of time, or if the situation is emergent and somebody just lost a family member and they're uncontrollably crying, sometimes you may need to put that touch on the first visit. And of course the use of voice. You notice it in the patients and in the doctor's question and answer session, like, yeah, no, and really, all those kinds of things are very, very important. So with that, I'm going to wrap up and say thanks. You've been a wonderful audience, and let's give everybody who participated another round of applause.